loveys, how are we? Happy Saturday. It is November 9th, 2024, and we are here. We are all together again. We're here. And today I thought, if you'll have me, that we could go over the testimony of Justin Rice, who was a ER doc, okay, at Good Samaritan Hospital. And I know that he works at like another facility now. I think he's at North Shore Medical Center. And he left Good Samaritan kind of, I'd say, interestingly, right after everything came out that this was going to be really going to trial. And I think he had been at North Shore for like a year now, as we're recording today. So I think it's very important for us to go and bring ourselves right back to where the rubber meets the road in this case. And where is that, babes? Medical evidence, science-based review of what was said and what was done on January 29th, 2022 is, in my opinion, the most important thing, right? Because everything else is interpretation. Okay? Every single other thing is what we have from witnesses, from their testimony, that nothing was recorded by the police. And so this is where we get the crux of all of the information as it relates to what happened to Officer John O'Keefe that night. So without further ado, let me say hello to all my best friends from out of town, because I'm an asshat and I forgot that I have to find the comments. Okay, do we have humans here? Hello, I'm Mrs. Doubtfire right now. Okay, we have, hi Kerry, hi. Oh, and Auntie Deb, look at, I got to go on Auntie Deb's this morning. It was lovely. Hi, Maddie Wags. Hi, Angela. Oh, am I buffering? I apologize. Hi, that weird girl, Kim. Hi, cousins. Hi, Boston 48. Oh, my Mimi. Hi, Mimi. Oh, where's my pearls, Mimi? Oh, I'll get the pearls. And we have Nana Robin. Hi, love. And hi, Shirley Girly. And hi, Lisa Buckley. And hi, Just Us. Oh, my goodness. Adam drives Helen. Who are we? Okay. The bitch is back, as they say. Okay, shut up, Kim. All right. Now we're going to just jump right into it, babes. I love everything about you. And let's rock out. Now, let's make sure that the desktop works. Okay. Mayday. Do. Oh, I don't know what I'm doing. Okay, that should be good, maybe. No, that's me. Okay. One more time for the good old girl. There we go. And it's going.
So when I obtained board certification, it was a two-step process where
we're going through Lally,
exam,
Lally.
Administered at one of the testing centers. And after you pass that, then there's an in-person oral exam, I guess is what they're called. And that's where you've given like didactic or individual cases. Assuming you pass that, then you're board certified.
And your board certification is up to date currently?
Yes.
Now,
he's board certified.
With reference to the time that you worked at Good Samaritan, as far as the emergency department is concerned, can you describe to the jury sort of what does the emergency department at Good Samaritan look like as far as staff, bedding?
Sorry, guys. I just want to see what he's board certified
Sir,
in.
if I could, I'd like to just talk a little bit about your educational background. Where did you go to
Sorry.
school as far as your undergrad is concerned?
I went to undergraduate at the College of William and Mary in Williamsburg, Virginia.
And what, if any, degrees did you graduate from there?
I obtained a Bachelor's of Science in Chemistry.
And following your graduation from there, where did you go to school after that?
So after that, I attended University of Virginia for medical school. Is that what you asked me? I'm sorry.
And following your graduation from medical school, where did you go after that?
Then I did a emergency medicine residency in Philadelphia at University of Pennsylvania.
And what is a residency, sir?
So residency is
Bless you, Karen.
this is several years of training that's where doctors will specialize. For me in emergency medicine, some people choose to be surgeons, pediatricians. That's when more of the specialization, if you will, happens in medicine, medical training.
And how long was your residency?
It was 4 years.
And following your residency, where did you go from there?
So I, in 2008, finished residency. I worked for 2 years in Manassas, Virginia at
2008.
Prince William Hospital for 2 years.
And are you board certified?
I am by American Board of Emergency Medicine, yes.
And what is it that you're board certified?
Specifically emergency medicine.
All right, babe. So now we know that he is certified in emergency room medicine, which is good to know. Thank you, Lally.
When you use that term as far as board certification is concerned, what goes into that? What does that entail?
So when I obtained board certification, it was a two-step process where there was a written exam administered at one of the testing centers. And after you pass that, then there's an in-person oral exam, I guess is what they're called. And that's where you've given like didactic or individual cases. Assuming you pass that, then you're board certified.
And your board certification is up to date currently?
Yes.
Now, with reference to the time that you worked at Good Samaritan, as far as the emergency department is concerned, can you describe to the jury sort of what does the emergency department at Good Samaritan look like as far as staff, bedding, sort of layout, like describe that to the jury?
Sure. So at the time and currently, there's
Please describe what the emergency room looked like. This is what we sat through, babes. Lord, hear our prayers. Let's put Lally on 1.5.
36 treatment rooms in the main ER. A lot of hallway stretchers as well.
36.
There's also an express care kind of area, but for the purposes of this conversation, 36 beds in the main ER. Staffing wise, there'll be anywhere between 4 to 5 and 12 nurses. And for the purposes of this discussion, it would have been 2 docs on and probably one either nurse practitioner or physician assistant in the morning.
And as far as the morning, what I'm going to turn your attention to is the morning of January 29th, 2022. Were you
It
working
would
at
have
Good
been
Samaritan on
between
that day?
4 and 5.
If that's the
Or
morning of
12
this
nurses.
incident, then yes. Yeah.
And is there a particular shift or what kind of hours would you be working around that time at Good Samaritan?
I'm pretty sure I started my shift at 6 a.m. that day. There was a 6 a.m. to 2 p.m. It was either 2 or 3 to, excuse me. It's either 6 to 2 or 6 to 3 p.m., but the shift would have started at 6 a.m. as I recall.
And on that date at Good Samaritan, do you recall becoming involved with a treatment of a patient by the name of John O'Keefe?
True.
Yes.
And Your Honor, may I approach the witness?
Yes. Oh. Oh, God. I thought that was me, babes.
So I'm showing you a document. If you could just take a look at that and look up on your
You want me to look through each page or just acknowledge that
Just as far as do you recognize what that
Oh, my
you recognize
Lord.
that?
is a transcription or a copy of
Oh.
dictated, and on the front page is also a
Oh.
it's all like a code sheet, which I've signed off on detailing what resuscitative efforts, as in the specific that were performed on Mr. O'Keefe's behalf.
Thanks. Your Honor, with the court's permission, may the,
What is happening?
Yes.
and Your Honor, what I seek to introduce in a minute is the next exhibit will be a redacted copy of those same records.
Objection?
Hold on, guys. All right, day 18. Oh, let me see if I can change this out. Sorry, guys. No. New tab. Oh God, that's really bad. Sorry, guys. Come on. Oh no. Okay, I'm blacked out. Currently blacked out. YouTube. Mr. Rice testimony. Hold on, guys. I'm trying to find another one. Oh, no. Well, has it blacked out anymore?
Was unresponsive and intubated, as in.
Sorry.
Here you go, doctor. This is for you.
Thanks.
Okay, thank you. And Mr. Lally, I'll let you hold on to what's been marked SS for identification.
I got something in my pocket for you, Deb.
Now, Dr. Rice, with regard to Mr. O'Keefe, about what time did he come into your facility at Good Samaritan?
Would you like me to look at the chart here? Let's see.
If you can't remember things and you need to reference the chart, you can do that, doctor.
Okay, thanks. So it looks like, based on the code sheet, first line starting at 0647, so I'll say 6:47 a.m.
And as far as his presentation, Mr. O'Keefe's presentation when he came into the emergency department, how would you describe his presentation upon his arrival?
So he would have been, well, he was unresponsive and intubated, as in with a breathing tube into his airway via his mouth.
And as he came into the emergency department, what, if anything, was fixed in regard to CPR or other resuscitative evidence?
So he would have had CPR in progress, and also someone would have been ventilating his lungs via the endotracheal tube.
Now, there's mention within that.
Okay, babes, we're just going to say focus, right? This is painful. That was an obnoxious couple of blackouts, okay? It wasn't me. It was YouTube, okay? And YouTube yelled and said, "We can't hear Lally," okay? It is physically making us blackout because YouTube is just like us. Okay, anywho, Justin Rice, Dr. Rice, tells us that Officer John O'Keefe presented to the emergency room at Good Sam at 6:47 a.m. on January 29th, 2022. He was intubated, which meant that he had an airway placed for him because he was not breathing on his own, and we know he was unresponsive. There was staff who was doing an ambu bag, and they were, pumping air into his lungs to attempt to oxygenate it.
record as far as a cardiac arrest. Is that correct?
I don't know. I'm sorry. I don't understand what you're asking me.
Sure. Let me just ask you, familiar with the term cardiac arrest?
Yes.
Can you describe to the jury, based on your training and experience, what your understanding of that term is?
Sure. So, as in he arrived with in cardiac arrest, which by definition means that his heart was not autonomously or independently pumping blood, or in his case, without electrical activity as well of the heart.
And are you familiar with another term called perfusion?
Yes.
And can you explain what perfusion is and how that relates to the condition of cardiac arrest?
Sure. So, for example, you and I right now, because our heart is autonomously, pumping blood, the heart is the pump and responsible for pushing blood throughout your body, therefore perfusing your body. In a scenario like this, where a patient is in cardiac arrest or asystole, or as in not having any electrical activity in his heart or mechanical activity of his heart, the perfusion that is happening is by CPR, as in the chest being pushed upon. Indirectly is, you call it maybe indirectly pumping or moving blood flow. So there is perfusion, but in a significantly limited compared to someone not in cardiac arrest.
And as far as that perfusion,
What the fuck? What in the shit did we just listen to, babes? Okay, that was 90 seconds on 1.25 of a dissertation of cardiac arrest. That means you do not have electric waves in your heart. Nothing is conducting in your heart. There it is. That's an arrest, Dr. Rice. Okay.
process is concerned, what, if any, relation does that have to the organs within the body?
Well, so, if your perfusion is limited, then your organs are not getting the normal amount of blood flow and therefore oxygen and all the other nutrients that your blood is providing. So your organs will begin the process of failure.
You use the term in there as far as asystole. Could you explain to the jury what you understand that term to mean?
Sure. So asystole would be when you put the electric.
I have to tell you, I secretly like that one, okay? And I'm not trying to be a smartass. When Lally says asystole, I almost like it. It reminds me of an Italian guy who used to live down the road from my Nana Phyllis. Hey, systole.
Leads on a patient's heart. The complete absence of intrinsic electrical activity from the heart would be asystole. So as in not having any observable or detectable electrical activity would be asystole.
Now, as far as these conditions, as far as cardiac arrest and asystole, what, if any, concerns does that raise from a diagnostic perspective in relation to Mr. O'Keefe?
I guess your question with respect to it from a diagnostic perspective, I don't know exactly what you're asking me there.
Let me rephrase that. So with regard to those conditions that are observed and noted within the medical chart for Mr. O'Keefe that you have before you, how would that relate to his condition or sort of how he's presenting and what, if anything, you're doing treatment-wise?
He's not alive.
Well, so even with good CPR, the perfusion of the brain, for example, and this is what I think about frequently during resuscitative efforts like this, as in, I couldn't tell you an exact time, but there's a certain, without perfusion of the brain for a certain amount of time, you're limited with respect to, the concern is that the patient, even if you resuscitate their body, that there's potentially going to be brain.
Hi, Nancy. Great question, Lovey. I just wanted to stop and answer that while we're on the heart questions. So poor Dr. Rice, I didn't remember this being as difficult to listen. I know that Lally is very difficult to listen to. I know that I had a couple of clutch my pearl moments during this testimony from the first time I saw it, but this is literally just you and I together answering each other's FaceTimes and doing a repeat, okay? And this is just, it's painful thus far, and let's hope that, we can get somewhere at some point. However, Nancy asks, did Officer John O'Keefe ever have a pulse? Do we even know? Per Anthony Flamati, per Timothy Nuttall, and per, I think, Katie McLaughlin as well in her testimony, nobody ever got a pulse on Officer John O'Keefe. And he'll tell us in this, Dr. Rice will hopefully get there. All right. We're going to try to get there for him to let us know, but definitely in the field, he did not.
Brain death or anoxia or lack of oxygen to the brain, and a poor outcome with respect to neurological outcome.
Now, as far as the resuscitative efforts are concerned, is there any sort of standard sort of resuscitative protocols that would be undergone with someone who presents as Mr. O'Keefe did?
Yes.
And can you explain what those are?
So, in broad terms, there's ACLS, which is advanced cardiac life support. That's an algorithm that through medical training, I've learned and is frequently, the algorithm can be adjusted. There's also a TLS for trauma patients. So there's an algorithm there with respect to resuscitation or guidelines, I guess, with respect to resuscitation.
And within those.
Oh my gosh, Loveys, I'm so sorry. I'm just going to try to keep us actually on task here. Do I have any nurses or any nurse practitioners, doctors? I don't know. I'm just saying. Or just our regular us guys, nurses. Have you ever heard of ACLS? Not ACLS, either our advanced life support or trauma life support or any kind of life resuscitation methods being referred to as an algorithm for your policy at your hospital? I've never heard someone call it an algorithm before.
Sort of guidelines and protocols. Are you familiar with a medication called epinephrine?
Yes.
And how would epinephrine play into sort of the treatment or the diagnosis of Mr. O'Keefe? So,
in the time that I've been practicing, epinephrine is probably the only medication or drug that has persistently been in the ACLS pathway. It's adrenaline. So the idea is loosely that you're attempting to affect upon the heart itself more squeeze, as in more pressure, and also to increase the potential, or if there is electrical activity, to increase the amplitude of that electrical function at the cellular level.
Now, in addition to the cardiac arrest and the asystole, as far as Mr. O'Keefe was concerned, what, if any, presentation did he have related to hypothermia?
So I know his initial temperature was low. I'd have to look, but I wrote in their notes that his, I see T equals 80.1 R. So I interpret that to be his temperature was 80.1 degrees by rectal temperature.
Okay, babes. And we knew this from medical examiner, Dr. Scorty Bello. We know that Officer John O'Keefe's rectal core temp was 80.1, and that was at 6:57 per the notes that Dr. Scorty Bello had reviewed. Now, we know that that is severe hypothermia. Anything under 95 degrees Fahrenheit is considered hypothermic.
And if you could explain to the jury sort of your understanding as far as hypothermia, what is it and how does that present itself?
So, as it pertains to this case, there's a few ways to get hypothermic. If I at 12:20 were to have a cardiac arrest right now and stop perfusing, my current temperature I'm guessing is 98.6, right? A normal temperature. Without perfusion, the body will lose, or excuse me, the core temperature will decrease over time. The specifics of that are beyond my knowledge and training, but does that answer your question?
Yes. And so as far as hypothermia is concerned, is there a certain sort of baseline or what is sort of the typical temperature under which someone would be declared sort of hypothermic or treated as such?
I don't know if I could give you a definition of medically what a quote diagnosis of hypothermia. I couldn't tell you a number. I can tell you that 80 qualifies as hypothermia, but I couldn't tell you a number under which that definition.
Ooh, that's rough. That's rough, babes, because that's textbook. Okay. That's not like per patient. That's not a specific, like giving us a question, right? Remember our NCLEX, guys, where it would be not what is the right answer, but it's what's the most right answer. This one is there is only one answer, and that is below 95 degrees Fahrenheit.
Applies.
But the temperature that Mr. O'Keefe presented with certainly fits within those parameters. Is that correct?
Yes, 80 degrees is very, very cold.
And as far as resuscitative efforts as they pertain to the core body temperature or the below core body temperature of Mr. O'Keefe, what, if anything, was done with relation to treatment of that?
Sure. So as the nursing note mentions, there's a bear hugger was applied. So that's a blanket that has warmed air being pumped through it. So that's a way of externally warming someone. He also, having reviewed the chart earlier, I don't see it right in front of you. Actually, I take that back. He had warm IV fluids running. So IV fluids not at room temperature, as in a warm or an oven of sorts, would have been given to him via intravenous or central venous access.
Okay. First and foremost, I am sorry. I just want, for anybody who is not a medical provider, I just want to correct things where I know they're correct. This is a physician. This is an ER physician. He is more than capable. This may all be anxiety. This may all be, I don't know, maybe he is having personal issues that is coming out on the stand. And I'm really trying to be not rude here. But we do not put fluids, any IV fluids, ever in an oven. It's not in an oven of sorts. A warmer is not an oven. Okay. Like, just in case you are not in the medical field, I don't want you to think that your bags of normal saline are being popped in to an oven at 350 and we're just banging those broads out. Okay. That's not how this works. Additionally, I do want to let you know that it's important that he told us that he got this through a central line. And we know that his central line, Officer John O'Keefe's, was started in the field via an interosseous, which is a line that goes directly from your lower extremity in your leg, and it goes all the way up. And that is how we were able to do the most possible in life sustaining efforts for Officer John O'Keefe in the situation and the circumstances that were presented the morning of January 29th, 2022. Those field paramedics did a bang up job. They did the best that they could. But I want you to note that he is saying that this went through a central line. So you know where he didn't get a line from? His hand. Because we don't do central lines via a peripheral hand line. Okay. So that is just something to think about when we are wondering, and some people have opined in other channels that the bruising they saw or the ecchymosis they saw on Officer John O'Keefe's right hand was related to a peripheral line, and that never happened. No educated medical professional would try to start a peripheral hand IV, the farthest away from your heart, on a patient without a heartbeat, and that is hypothermic. I digress.
And as far as the body temperature is concerned, what if any relationship does the body temperature have and the warming process have as to a declaration of deceased in relation to?
Well, so there's a goal in resuscitative medicine to attempt to rewarm a body. Loosely, the idea being that the heart, among other organs, will function better or function at all in a warmer environment. That's one goal of resuscitation. With him, as I recall, despite resuscitative efforts for approximately half an hour, there was not a significant warming of his core temperature.
And so, sir, with reference to Mr. O'Keefe, at some point, was he pronounced deceased by yourself?
Yes.
And do you see any indication within the chart as to what time that was?
Sure. I just need this moment here. According to my note, it looks like the time of death was death declaration was 7:50 in the morning.
Is that 50 or 15?
50.
Now, as far as the observations that you made, as far as a systole and the cardiac arrest, did that persist throughout the course of your treatment of Mr. O'Keefe?
Yes.
All right, babes, we knew this, but I just wanted to reiterate that Officer John O'Keefe was pronounced at Good Samaritan Hospital on January 29th at 7:50 a.m. And he also, what else did I want to just say? Yeah, that was basically what he is telling us. And now let's see if he did have a pulse at any time. It appears as though, as much as he remembered Officer John O'Keefe, he didn't remember too much because he sees several patients. Oh, and Adam drives Helen. He didn't go to Mass General, so he was not ever transported to a Boston hospital because Good Sam is the highest level trauma hospital that they have in that area.
May I approach the witness?
Yes.
It's a level 1 trauma.
Mm-hmm.
Direct your attention to what's the fourth page in, the bottom of it says 2 of 4, and I direct your attention to the top of that page. Can you see that, sir?
Yes.
And as far as this is sort of a listing of observations, or let me ask you, can you describe what is listed at the top of that page there?
Sure. So this would have been the physical exam documentation of my note. So with respect to the head, it says, excuse me, the first word is other, which I believe is a function of the computer system. As in, I typed in the right superior orbital ridge region, approximately 7 millimeter laceration, and then with surrounding soft tissue swelling / contusion.
Sir, if I could just stop you there. As far as what you're talking about with the right superior orbital ridge region, could you explain to the jury or demonstrate?
All right, we got to go back. Sorry, babes.
To rewarm a body, loosely the
Not that far.
Describe what is listed at the top of that page there.
Sure. So this would have been the physical exam documentation of my note. So with respect to the head, it says, excuse me, the first word is other, which I believe is a function of the computer system. As in, I typed in the right superior orbital ridge region, approximately 7 millimeter laceration, and then with surrounding soft tissue swelling / contusion.
Sir, if I could just stop you there. As far as what you're talking about with the right superior orbital ridge region, could you explain to the jury or demonstrate to the jury?
Sure. So the orbital ridge is the bone above your eye that you can, like, where your eyebrow is or should, would normally be.
And as far as the other sort of things that you noted over the course of your physical exam or review of Mr. O'Keefe, what, if anything else of note, did you observe?
Well, according to my note, the only other kind of observations other than would be that he had breath sounds present bilaterally. He also, I observed that he was pulseless. His
Okay, sorry, that's painful. Listen, what we want to take from that is in his right eyebrow, in your orbital ridge, he had a 7 millimeter, small, but a millimeter, okay? And he had a contusion and swelling, okay? But he's only saying on that right side. Now, if we remember going back to the autopsy photos of Officer John O'Keefe, God rest his soul, we know that his eyes, he had bilateral swelling in his orbitals. And we know that he did have the right, it was considered a laceration, I believe, above his, right above the right eye. But he also had cuts on the left side of his nose. So opposite, sorry, Kim, because my camera is. But then it'll be this side and right here on his nose.
abdominal exam was atraumatic on my chart, and then extremity exam or musculoskeletal exam, I wrote that he had superficial abrasions on the right forearm.
Yeah.
And from a medical perspective, when you use that term abrasions, so can you explain to the jury what you understand the term abrasions to mean?
Yeah, I use it as a medical synonym for scratches, if you will.
And under
Woo!
neuro or neurological,
Ooh, ooh, sorry. Who? What are we doing? She is a owl. Okay, focus. Scratches. You know what doesn't scratch you, babes? A taillight. I find that interesting.
there's a listing as far as a GC3, is that correct?
Yes.
And can you explain what that is and what that means?
So GC is what I charted. What I intended to write there was GCS, which is a Glasgow Coma Scale, which is a scoring system to identify someone's level of consciousness or unresponsiveness.
And as far as the 3, what is, like, where does the scale start? Where does it go to, and where does the 3 fit in?
So there's 3 components: verbal function, motor function, and eye or ocular function. And someone who's completely unresponsive, as in no motor, no verbal, and no eye movement or function, completely unresponsive, the lowest you can get on the scale is 3.
Thank you, sir. May I approach?
Sorry, babes. So that is the Glasgow Coma Scale. Is we use that, and that is going to tell you that he had no response in his eyes, so he couldn't follow clearly any commands, right? Then speech, no response, and no motor skills. So, and you get a 1. That's the least number you can get. So it's a 3 to a 12 or 15 rather. Let me 15 is the best. Okay.
Just to retrieve.
Yes.
Now, later on over the course of that same morning, did you have occasion to become involved in the treatment of another patient by the name of Karen Reed?
Yes.
And may I approach the witness again, Your Honor?
Yes.
So I'm showing you another document, just ask you to look at that to the extent you can recognize it and look up whenever you finish. In general, sir, do you recognize what that is?
Yes.
So what do you recognize it to be?
The first part I recognized would have been the medical record or medical note with respect to Miss Reed, who was also a patient that morning.
Thank you. Your Honor, the Commonwealth seeks to introduce in the minutes the next exhibit, a redacted copy of those records.
No objection, subject to the redactions.
Can you imagine, babes, just for a moment, that he is the physician, the ER doc, that is treating both Karen Reed and Officer John O'Keefe that morning?
Exhibit 106.
Thank you.
Now, sir, if you know about what time was it that Ms. Reed came into the emergency department at Good Samaritan that morning?
I mean, I can tell you from this chart, it looks like that at least the first posted vital signs were from 7:51, 5:1 in the morning.
And in reference to Ms. Reed, what is it that she came into?
Sorry, 7:51 was Karen's first vital signs. Now we're getting into this, babes.
Samaritan in regard to? Why was she there?
I'd have to review Daisy's note. So,
Well, let me ask you this. sir. Was it in
Daisy's a
reference to
nurse.
Section 12? Do you recall?
yes.
I cannot. He had access to this, babes, before he came up to testify, and he did not know what Ms. Reed, who was on trial for the unaliving of Officer John O'Keefe, for second degree unaliving of him, and he doesn't recall what she was in that hospital for.
And with regard to Section 12, patients that come in regard to that, what kind of involvement do you have, or who, if anyone, do you work with in regard to those types of patients?
Sure. So Section 12, I would define as an involuntary detention of a person, usually for a mental health concern, whether that's self-harm or harm to others, or if someone who's afflicted with schizophrenia or psychosis, members of the public can bring someone to the police, or members of the public can bring someone to the hospital on a Section 12, which again involuntarily detains them for evaluation.
And in addition to yourself, is there other staff? You mentioned that there were physician's assistants or nurses that were working. How much involvement would?
Sorry. I've got to correct the record. Sorry, Dr. Rice. That is not correct in the Commonwealth of Massachusetts. So Karen actually wasn't wasn't involuntarily taken to the emergency room. Yes, she went via ambulance, but it was a voluntary because she didn't want to have to go through a 72-hour hold. Okay, that's a 3-day stay. So she had to go get evaluated at the emergency room at Good Sam, and she was allowed and determined that she was no longer a risk to herself or others. Now, saying that somebody that has schizophrenia might be put on or mental health issues would be put on in Section 12 would only be that if they were a risk to themselves or others. You are not just like people with schizophrenia are lovely as the day is long. And you don't just get put on a Section 12 because you have a chronic mental health or a mental illness or any kind of depression, anxiety. It is only when you pose a risk to yourself or others. Okay.
you typically have with someone who comes in on that kind of prognosis or diagnosis?
I would say, to answer your question, my involvement is variable and dependent a lot of times on what that nurse practitioner or physician assistant feels like they need or want my involvement to be.
And what kind of involvement would you have as far as when someone comes in with that kind of issue? What is sort of the typical protocol or policies that a Good Samaritan would undergo with reference to that patient? What are you doing with reference to the patient when they arrive?
I'm sorry, I think I don't really understand what the question is.
No, understood. Let me rephrase that. So with regard to a patient coming in on a Section 12, what happens with that person once they present in the ER?
So whether they're evaluated by me or a nurse practitioner or physician assistant, if that person feels like, based on their evaluation, that they need a mental health consult or evaluation, then they would have that initiated, as well as what we do for a lot of patients or all patients, vital signs, and sometimes blood work as well.
And when it comes to that sort of blood work or assay, as far as
And this is where she comes in. Mr. Yannetti, take me home tonight. I don't want to let you go till you see the light. Okay, sorry. Listen to me. Sometimes blood is taken. This is not a mandate. In other states, I've heard from my colleagues and beautiful other smart and pretty RNs that work in the emergency room or any other facilities. They say, Kim, it's mandated in our state. Well, it's not in Massachusetts. So let's fucking go. I want to know why. I want to know how. I want to know who gave consent and where that form is immediately.
what's being done with someone who comes in with that kind of report, what is sort of being tested and what is being looked at as far as the blood work is concerned?
Well, there's a few reasons to get blood work, but in general, part of the evaluation is, with respect to the medical presentation, to make sure there's no medical emergencies present, in addition to whatever the mental health concern may be. There's also blood work drawn with respect to disposition, as far as some people, for example, it would be inappropriate to have a mental health evaluation if, for example, I were intoxicated on alcohol and my alcohol level were elevated, because I think the idea is that you're not getting, a true representation maybe of what's going on.
So am I correct in that?
What? What are you talking about, Dr. Rice? I'm trying not to be a jerk here, but there are plenty of times that our patients have come in, and being a risk to yourself or others could be that perhaps you did take a bottle of narcotics and swigged it down the back of your throat with a bottle of whiskey or whatever it may be. So that would absolutely be a true representation of a mental health crisis and a need for a Section 12 in that specific circumstance. However, he says to us that it is for a medical baseline, babes, and that is huge, huge. Because, draw my CBC, a BMP, whatever you want to do. Our regular, you want a lipid panel? Fucking A. Okay, let's go. But for them to get a specific tox screen without being told by any paramedic or any police that there is a concern of Karen Reed being intoxicated, because nobody wrote it down. So where did this come from? I don't know.
That someone presents and then there's like sort of you medically clear that person as far as any sort of injuries or anything like that first?
I wouldn't say first necessarily. I think a lot of times these processes happen in parallel.
So in parallel, you have the medical clearance and then sort of psychological clearance as well.
Sometimes, yes.
And then sort of involved in both of those, there would be blood drawn and
Hold on, Amy. I wanted to get to that question. Amy, you asked us, okay, here you are, babe. Does this doctor, Dr. Justin Rice, still practice at Good Sam? No, babes. He's over at North Shore Medical Center now. But he is still practicing.
reference to a section 12 as far as a typical one would be looking for sort of alcohol and drugs of abuse, things of that nature.
I mean, I'm hesitant to answer yes because of the word typical, because I wouldn't say there's really a typical presentation with respect to mental health presentations in the ER.
And from your memory and or your review of the chart, was that done as far as the blood work done with regard to Ms. Reed on this day?
You're asking me if blood work was drawn?
Yes.
I believe so. I have to double check. So yes, it looks like there was blood work drawn.
And among the things that were tested within the facility within Good Samaritan was the alcohol screen. Is that correct?
Yes.
And what is the result of that alcohol screen as contained within those records?
Do I answer or no?
Yes.
So it looks like 93.93. I'd have to.
All right. So they did 93 deciliters per milliliter, right? Is what the result was, because I think he'll go into that, what type of draw this was. But I have a question, Bibbs. Was there also, why is there an ETOH screen? Because he doesn't say anything about like a talk screen. We have different panels, right, that you could do. You either have a 5-panel talks, you have I don't know, you could do up to 11. There's more that go down to opioids instead of having like it could go down to like hydromorphone. It could go to oxycodone. You can get very specific blood levels in panels of talk screen. I'm wondering why ETOH was the only one triggered.
Maybe look deeper in the chart to tell you the units of that measurement. I don't want to guess. So, but to answer your question, 93.
May I approach just briefly on?
Yes.
That's what it is.
I just. I'm directing your attention to a tab portion of that.
Sure.
Oh my God, I am Bev.
93 pertains
Look
to
at
contains
Bev.
in that
It's me
record.
right now.
So yes, it looks like it's milligrams per deciliter.
Thank you, sir.
Oh, milligrams per
May I
deciliter.
approach just to retrieve your?
Yes.
Oh, sir, you're sniffling.
Thank you, sir. I have no further questions of this witness, Your Honor.
Right, Ms. Little?
I have questions. I have a lot of questions.
Good afternoon.
Hi.
You testified that you treated Ms. Reed when she arrived at the hospital on January 29th, correct?
I don't know if I testified that I treated her, but I was involved in her care. Yes.
You actually wrote the reports regarding.
Nurses, hi, just me. Well, he doesn't know if he treated her, but his name is on all of the reports of her, which we know. Who am I shitting? Absolutely. Would he know anything that went on? Probably not. But maybe, just maybe, review your documentation before you are on a nationally televised trial, good sir, that is very serious, that is regarding the death of a Boston police officer, Officer John O'Keefe, and his girlfriend, who is sitting in front of you, who you at least saw at some point. I'm sure she remembers your damn face, and she's facing going to jail for the rest of her life for unaliving him. Oh.
Regarding her care, correct?
That is not correct.
Would it refresh your recollection to take a look at the report?
The report, I believe we're talking about the note, the emergency room note was written by a nurse practitioner.
Would it refresh your recollection to take a look at some additional reports from January 29th?
Sounds like you want to show me some reports, so sure.
Holy shit. Don't you ever talk to Liza Little like that. Fucking Snifflesaurus.
May I approach? Yes. Take a look.
Yep. Okay.
Is your recollection refreshed? Do you recall treating Ms. Reed on January 29th?
I do not.
Do you recall?
Ooh, that's a blow. That is a blow. Now, first and foremost, if somebody and if a lawyer happens to shove that directly up your actual ass, good sir, maybe you could have said, instead of, okay, maybe you could have said, oops, I apologize. You are correct. But no, as usual, we're dancing around the egos of men. Okay. Story of my fucking life. And this is, this pisses me off for Liza. This pisses me off for Officer John O'Keefe. And this pisses me off for Karen. But he still says very bluntly, very nonchalantly, I don't remember it.
Called writing a report that has your name, Justin Rice, on it from January 29th?
No, it depends what you define report as. To best answer your, well, do I recall writing this note? No. Was that what your question was?
So is it your testimony that do you recall treating Ms. Reed at all?
No, I don't.
Do you recall actually ordering her blood in this case?
No.
Do you recall?
Here it is. Sorry. Whoo, she's an owl. All right. She's whooing all over town. Okay. This is something we have from trial 1 now, testimony where this physician who ordered the labs for Karen Reed, who says, I don't recall doing this. You don't? You don't? Okay. I wonder, good sir, if I looked through those medical records and I don't see something that says Karen Reed had slurred speech, Karen Reed came in because we know that she drank 9 drinks at somewhere, okay, at an unknown establishment. If I don't have that she was driving a vehicle and she struck something and she needs to be taken to the emergency room, treated medically, and then we're going to arrest her for a DWI, I'm fighting back like a motherfucker. I want to see these medical records because let me tell you, babes, if there was no reason for him to draw those labs and no reason for him to put that order in because it's not mandated in the Commonwealth of Massachusetts to do a tox screen, a blood draw, of an ETOH, anything. And if there was no signs and symptoms that he noted in his documentation, or Daisy, okay, because we know Daisy did all the work, the nurse, if she didn't write anything that indicated that there was an alcohol intoxication or question thereof, then let's roll dice here. Because you didn't have the right to take Karen Reed's blood, in my opinion.
Sending it out to the labs at all?
No,
Nope, he doesn't
As you sit here
remember.
today, you don't know who collected the blood?
that's correct.
You don't know who packaged the blood?
That would also be a fair assessment, yes.
And you don't know who submitted that to the lab?
Correct.
It wasn't you, correct?
I can confidently say that I did not collect blood work. I did not do that.
Okay.
He hasn't collected blood work since 2008. Who was he shitting? Okay, I can't.
You testified that you treated Mr. O'Keefe upon arrival on January 29th, correct?
Yes.
Did a firefighter ever approach you on the morning of January 29th and tell you that he had information suggesting that the victim had been struck by a vehicle?
Objection.
Do you remember that?
I do not.
So if a firefighter indicated that he informed you that he had information suggesting that Mr. O'Keefe had been in some sort of vehicular accident, that's something that you would have included in your report, correct?
I don't know if that's a fair assumption.
But as you sit here today, you have no recollection whatsoever of anyone telling you that the victim had appeared to be in some sort of car accident, correct?
Well, I think I don't have it in front of me, but I think my note that I prepared for Mr. O'Keefe states that per EMS for.
Look at me and Karen. We're looking at it the exact same way. What do you think your report says? But this is big doings, babes, because him saying that he does not recall Anthony Flamati, who was the lead paramedic at the scene at 34 Fairview, who went to the hospital at Good Sam. And remember, Anthony Flamati told us that he stayed there for an additional 20 minutes. He gave a beautiful report. Of course you do. That's what happens when you are coming from the field as 911, right? And bringing a patient to the hospital. You give a report, whether it's in Daisy's note, whether it's in Justin Rice's note, it's somewhere. If anybody had said that he was, she said, I hit him, or we believed he was struck by a motor vehicle, it would have been somewhere in hospital documentation because that is imperative in the treatment of the patient.
Sorry, what was that?
Dr. Rice, you have no record. Apologies.
So I don't think he finished his answer.
So I think that what I was trying to say, right, was that on my note, it says per EMS report. So one of the medics as in one of the folks on the ambulance who brought Mr. O'Keefe in. Again, I'm not right in front of my note, but as I recall, it said something to the effect of, per EMS report, the patient may have been struck by a vehicle.
Can I show you a copy of that report?
Please.
Woo-wee. That is very bold. That is a bold statement. He's saying that when he got report of Officer John O'Keefe coming in, like we just talked about, that the EMT said he was potentially struck by a motor vehicle, an MVA is what we call it, okay? Now he's saying this is in his note about Officer John O'Keefe, because not only did he treat Officer John O'Keefe, but he also treated Karen Reed. Now, Liza Little is over at this, and let's see, because I think that it's kind of, Karen's face just said it all about what was going to be found or not found. Yes, 100% love it.
May I approach?
Yes.
You could take a look at that.
All right. So,
I'll ask the question. Is your
course.
recollection refresh?
yes.
Is there anywhere on that report that says that the patient came in and there was a statement by EMS that the victim appeared to have been struck by a vehicle?
Just give me a moment to read through the.
Sure.
So no, there is not.
In fact, there's no mention of a vehicle whatsoever, correct?
You lying son of a bitch. We'll check both sides.
That's correct.
Dr. Rice, did you observe Mr. O'Keefe's injuries when he arrived at the hospital that morning?
I guess you.
Sorry, guys. I don't mean to like do this, but this is huge. This is like bomb drop huge stuff. I'm not saying that he has anything, he clearly is not in any kind of a conspiracy. However, this is what happens when you believe what you have been told. And he thought that, oh, well, I know that Anthony Flamati says that he said this. I feel like we have talked about this. I feel like he knew what the Commonwealth's theory was. And in some alternate universe he lives on, that he didn't think that he would know that information from his documentation backwards and forwards about a nationally televised case. You can be as anxious as the day is long, babes. We know I clutch my pearls and I have elephants sit on my chest every day. I am one of the most anxious people that I know, okay? And this is a very uncomfortable situation. I am 100% sure for him. He's probably not had to do it often in his career, and it is something that takes a lot out of you, especially when you're an ER doc who is seeing patients in and out, right? It's the first one in, it's the next. You are triaging to who is the most important, and you do not build rapport and relationships with people in the ER typically, right? Unless they're your frequent flyers, then you're like, hey, Charlie, right? But other than that, you don't know that. So I get that he wouldn't know this off jump, but he sure as shit had the opportunity to review everything. And Liza Little asking him that question, and his response says an awful lot about his preparation with Adam Lally, if you ask me, and kind of where his mindset was that day.
You have to define what observe injuries means.
What did you observe?
Well, during the course of your treatment, did you inspect him for injuries?
So, yes,
You testified that you observed certain abrasions and scratches on his right arm, correct?
yes,
Aside from his injuries to his right arm, and I believe you described sort of a laceration above his eye,
hmm
John O'Keefe did not have a single other injury on his body from the neck down, correct?
I don't know if that's fair to say.
Well, that's 100% not right, because he had a 2.5-inch laceration to the back of right of his head, of his occiput, of his skull. And this ER doctor, who was providing life-sustaining treatment and measurements, did he not document that?
Well, you didn't report a single injury to his shoulders, correct?
Correct.
You did not report a single injury to his chest, correct?
Correct.
You did not report a single injury to his torso, correct?
Correct.
You did not report a single injury to his back, correct?
Correct.
You also did not report a single injury to his ribs, correct?
Correct.
No injury to his hips, right?
Correct.
You observed no injury to his knees, correct?
I reported no injuries to his knees. Correct.
No injuries to his shins, correct?
Correct.
No injuries to his ankles, right?
Correct.
And no injuries to his feet.
Correct.
From the neck down, he did not have a single broken bone, right?
I don't know if that's a fair assessment or statement.
You certainly didn't notate in your report that he had any broken bones from the neck down, correct?
No, I did not. I'd happy to explain that, but to answer your question, no, I did not.
You did not report a single fracture from the neck down, correct?
I did not report a single fracture. Correct.
The injuries that you testified to today were that he had sort of a laceration above his eyelid, correct?
The injuries that I testified to today, correct, yes.
And the scratches on his right arm.
On the right forearm, yes.
No further questions.
Wait a minute. They didn't mention, oh God, help us. So he didn't mention, and he did not document what Officer John O'Keefe died from, right? Because our medical examiner, Dr. Scorty Bello, and our neuropathologist, Renee Stonebridge, eloquently provide us the information in which we need to note the catastrophic injury and brain damage that was sustained by Officer John O'Keefe. Okay? It is noted that the 2.5-inch laceration to the back of his right occiput is what radiated fractures, per the Commonwealth's theory, to the front of his skull, to under his orbitals. It was all from an origination of his right occiput and that blunt force trauma to his head. It wasn't a 7-millimeter laceration to his fucking eyebrow. I'm actually blacked out right now. Hold please. Let's play that one more time.
Aside from his injuries to his right arm, and I believe you described sort of laceration above his eye, John O'Keefe did not have a single other injury on his body from the neck down, correct?
I don't know if that's fair to say.
Yeah.
Well, you didn't report a single injury to his shoulders, correct?
Correct.
You did not report a single injury to his chest, correct?
Correct.
You did not report a single injury to his torso, correct?
Correct.
You did not report a single injury to his back, correct?
Correct.
You also did not report a single injury to his ribs, correct?
Correct.
No injury to his hips, right?
Correct.
You observed no injury to his knees, correct?
I reported no injuries to his knees, correct?
No injuries to his shins, correct?
Correct.
No injuries to his ankles, right?
Correct.
And no injuries to his feet.
Correct.
From the neck down, he did not have a single broken bone, right?
I don't know if that's a fair assessment or a statement.
You certainly didn't notate in your report that he had any broken bones from the neck down, correct?
No, I did not. I'd happy to explain that, but to answer your question, no, I did not.
You did not report a single fracture from the neck down, correct?
I did not report a single fracture, correct?
The injuries that you testified to today were that he had sort of a laceration above his eyelid, correct?
Here it is, babe. The injuries that he documented, I'm sorry, I went back too far, was a laceration above his eyelid and
The injuries that I testified to today, correct, yes.
And the scratches on his right arm.
On the right forearm, yes.
No further questions.
blacked out.
Dr. Rice, with reference to fractures or broken bones, can you explain sort of why that may not have been noted or why that wasn't included within the chart?
Sure, yeah, I'd like to. So with a patient like Mr. O'Keefe who came in, the focus of myself and the team of physician assistant, nurse practitioner, and nurses, whoever was helping in a case like this, the focus is in core resuscitative medicine, of securing an airway, making sure he has a.
Okay, sorry, I've got to push back because yeah, I fucking do. So, pardon my French. I don't have my pearls on. So your job is core resuscitative efforts, is bringing a patient from a cardiac arrest with no rhythm, no electrical impulse, right? You are somebody who is flatlined and somebody who is hypothermic, and your only job is to bring them, try to bring them back in a resuscitative effort. But you don't know where the blunt force trauma is that caused his life during your resuscitative efforts. May the force be with us all.
Breathing tube in, making sure that the CPR is being applied the right pressure to the right place, making sure that the core resuscitative elements of medicine are happening, unless as in the mind can only focus on so much. So I think in cases like this, because the attention is on resuscitation of someone's heartbeat, their life, there's less focus on injuries or observations that don't coincide with the resuscitation effort or not pertinent to that resuscitative effort. If that answers if that answers your question.
Anything, injuries that are not pertinent to that resuscitative effort. Did you apply pressure? Did you know what happened? This is very concerning.
So in that vein, it's not like you're doing x-rays or a full skeletal survey or something like that.
No, we're not doing a full skeletal survey, no.
Because you're more concerned with the fact that his body core temperature is 80, his heart isn't pumping blood, and he's pulseless, correct?
Correct, unless there was an extremity injury that would be pertinent to his resuscitation. If he
Yes,
had had a
Bobby.
traumatic amputation, as in removal of a leg, for example, that would be pertinent to a resuscitation. But an otherwise intact extremity, you know, that is not necessarily within the realm of resuscitation.
Now, may I approach the witness?
Yes.
I'm going to direct your attention on the document. Indicates discharge and clinical impression. If you could just read from that, look up when you finish. Read to yourself.
I'm sorry, what would you like me to read out loud?
So as far as the chart is concerned, as far as your clinical impression of Mr. O'Keefe, can you read sort of what you?
Sure, right. So I wrote clinical impression, cardiac arrest, comma, head trauma, comma, exposure to environmental cold.
May I approach just to retrieve her?
Yes.
No further questions.
He didn't say, he's saying, oh my God. Okay, I'm not even joking. Somebody get me the medical records. I'm going to need to see this shit at this point, okay? I need to, guys, because I need a direct line to Mr. David Yannetti. Put me in, coach, because this does not make sense. He said head trauma, and he looked over all of his notes as we've been watching him, okay? We saw everything that he did. He told us what he documented, and he did not document anything to the right occiput of Officer John O'Keefe's head. So you're saying that the trauma to his face was his laceration above his eyebrow? Well, then now we've got even bigger problems. If you're saying that Officer John O'Keefe, Dr. Rice, had front facial injuries and head trauma, then that's not looking like he got struck in the arm with a almost 7,000-pound Lexus, pirouetted counterclockwise, and landed on the back of his skull in the lawn of 34 Fairview. Does it? Because it's never been alleged that he had frontal trauma to his face, which we all know he did, because of the subarachnoid bleeds to his frontal pole, his bilateral temporal lobes. We know that his brain stem herniated. Guys, this was so catastrophic to Officer John O'Keefe. And this ER physician is saying he had trauma, but the only trauma reported is to his front eye, right side eyebrow.
No further questions.
All right, thank you, doctor. You are all set.
Thanks.
I'm blacked out. I'm looking at him just like she is. Who's that little girl next to Madam Court Reporter?
Rather than where it's 10 minutes
Oh.
one, Joyce, can we do an abbreviated lunch today? So
Can we do an
get as much of the
abbreviated lunch?
testimony
I
as
almost miss
possible?
you, Bev.
So it's 10 minutes of one. Why don't we?
No, I
come
don't.
back
I
here at
lied.
1:30? And can we go into?
Okay. Sorry, babes. Let me get out of here. Who? Okay. Can I do this? Remove. Okay. So now it's me. Hi. Hi, loveys. What do you think? Tell me everything. This is wild, right? Like, I didn't know, because I haven't watched it in what, friggin' 5 months. But to see that and to hear that is huge. And you know what you can't do is have new staff from a hospital, because even though Justin Rice doesn't work for Good Samaritan anymore, he's at North Shore Medical Center, he's still going to have to go and testify if there's a second trial. I have so many questions. So many questions. Yes, Mindy, that is so sad. Everyone failed Officer John O'Keefe. Debbie K.E. says, is this dude really a medical doctor? Really? How can Peggy sit through that mess? I don't know. I don't know if I noticed that the first time I heard testimony. But, Liza did a great job giving him the business at the end. But we didn't mention the fatal, mortal wound. I can't. Oh, gosh. It is Maya. She says despicable. And Don't Be Hating says, why is he minimizing the brain stuff, even if it was a car accident? So that's an interesting question, Lovey. And I think that he didn't know the brain stuff, right? Because he wasn't looking in Officer John O'Keefe's brain. That was our neuropathologist in the medical examiner's office who was able to go through and see that catastrophic injury. Justin Rice, the ER physician, he didn't see any of that. All he was seeing was, trying to see if he was going to be able to get some sort of responsiveness from an unresponsive patient. And Shirley, I don't know, we might have had, I don't know what was going on with him. He probably needed some Claritin because he was a snuffleupagus over there. Okay, babes, I'm going to just go through. Thank you so much for doing that with me. And I do want to go over there one more testimony, and that is of a physician that was doing or who went over the process of the lab samples at Good Samaritan. I found that, it's very dry testimony, but there's a lot of information there. So I'll do that at another point too. But I think it's so important for us, babes, to stick to medical facts. Facts matter. Journalism. Okay? Facts matter. Officer John O'Keefe's life matters. Karen Reed's life matters. All right, babes. Show. Love a Romy with cheese. She says, was that word salad, Dr. Rice? Absolutely it was. Dr. Rice might have had a TIA while he was on the stand. And like we said, he might be anxious. And I don't know because I can't imagine the stress of being on a nationally televised huge trial like this. But I would tell you guys that I have had to go to court and testify. And what I do is I have to review everything. And you know me, I'm crazy. I'm sitting there like, I know things front, back. I know other nurses' notes or doctors' notes, what is in their documentation, in not just my own. Like, I want to know everything that I have the right to look at, I'm looking at so that I can be prepared and so that I'm doing the right thing. I don't want to look like a walking asshole. Hi, BLT. Hey, Nurse Kim. Thank you for your content. Free Karen Reed. Free Karen Reed. And Coffee Cake says, question, whose car did they, Jen, Carrie, Karen, drive to 34 Fairview? Coffee Cake. That was Kerry Roberts' SUV that the girls all drove. And Rebecca Jones, I love your puppy. Here is the problem. Lally did not properly prepare many of his witnesses, and that's part of his job. Auntie Bev should have reminded him of this. Listen, Rebecca Jones, you're on it, sister. Okay. You know exactly what the frig you're talking about, because this is it's almost like he's checked out, Rice. You know what I'm saying? Like it's very odd and off-putting. And to hear him almost like his attitude towards Liza Little, and I'm not trying to be whatevs, but I'm just saying that there are plenty of doctors that are incredible, amazing, wonderful, magical, 10 out of 10 would recommend. But every once in a while, we have a doctor that cannot allow you to, like, you don't know shit as a nurse, right? And so I have to let him think that it was his decision and that he thought of it in order to get my patients what I want, because I can't know anything. He knows everything. And I have to work around him. That is more like the olden days. I've been a nurse for a long time, a very long time, almost 18 years now. And those are the things that I, like, I've learned to manage throughout the way, along the way, of how can I get this so that my patient is taken care of and I don't give a fuck. I'll put my shit to the, who cares? I don't need to be right about anything. I'm just a girl. I don't even know why I'm here. Okay. I just put on this outfit and showed the fuck up. Oh my God, you are so smart. It's interesting that still goes on, but it does. And to see him the way he was and come off the way he did, it's like he's so checked out. And Rebecca Jones again, and my favorite lovey puppy, says, as LEO in California, if I have one arrested for mental health act, I sit at the hospital with them until cleared by medical and psych. Any blood taken that might be evidence. Oh. And again, Rebecca Jones, I have to ask a nurse to seal it and initial it and note this in my book because we need a warrant approved before police can access any info that blood contains. Yes. Immediately, yes. Everything, yes. That is how I believe it should be. And it's not technically that way in the Commonwealth, but we do have a new law from 2022. There is always a warrant that is needed. But when AJ got up and argued this, babes, back pre-trial, before trial number 1, AJ got up and said, I don't know how this blood was taken. It wasn't taken by the Mass State Police. She wasn't arrested for a fucking DWI. Pardon my French. I'm so sorry. And why is it being taken and submitted? And then you guys have to put it into a different calculation because it wasn't whole blood. It was a serum, not a whole blood. There is there are different ways you can take blood, and it wasn't taken in the way that Mass State Police take it. It wasn't done by the testing method that Mass State Police test it. And AJ said you didn't have a warrant for it. I don't know how they got all the shit, if you ask me. And Stacy Face Travels says it is embarrassing to the medical community. I totally agree, babe. It's things like this. And like, listen, we're not perfect. I am a fallible human. Who am I? Nobody. Okay. I'm just Kim. I'm just your friend. And I've been a nurse for a long time. And if one thing I can say in my life is that I'm proud of myself for the nurse I am. And I really have had incredible experiences, and I've learned so much in the last almost 18 years of my career. But of course you make mistakes. I'm not perfect. None of us are. But when you look at all of these in totality and you look at how Officer John O'Keefe presented on that fateful morning of January 29th, it will never align with Karen Reed striking him in her 7,000-pound Lexus at reverse at 24 miles an hour in a 4-second time frame, in a time span. It doesn't make sense. And I know, listen, shit presents in weird ways. Like, of course, could it be a freak accident? Could there have been something there? Could he have smashed his head on the ground to a boulder, to something else? Absolutely. But the Commonwealth hasn't told us that. So Karen Reed should not be accused of this. If 1 + 1 doesn't equal 2, we have a problem. in my opinion. And Kind of the Necessary says, I've been an RN for 15 years. Congratulations, Lovey. Even in the ER, I still have vivid memories about major traumas, etc. This is BS, babes. I totally hear you. My only traumas, and I've been out of trauma since like before the last decade, okay? But for me, but I feel like for nurses, it's different than doctors. I don't know why, but I feel like I remember everything. I remember patients that I had when I was doing clinical, when I was in nursing school. I tell you guys the story of Nurse Kim in ortho, and I needed a friggin' Skittle because I was blacking the fuck out with seeing a Black & Decker tool. Okay, Bob Vila was in the goddamn ortho in the hospital at Leahy fucking Clinic. I'm like, I'm going down. Same thing happened to me at Emerson. I can't, like, I'm not ortho. Okay, I'm not your girl. But there are specific, I remember exactly what surgery was being done, you know, like you remember that shit. And I feel like us as nurses, we remember our patients. And I'm not saying that doctors don't, because doctors are incredible. Our PAs are incredible. Our NPs are us, but they can prescribe. And, you know, it's just very, very interesting to see how different levels of care in their documentation and in our patient outcomes, in my opinion. And Maddie Wags said, he seemed anxious at first, but the second Liza asked him a question, he suddenly had a huge attitude and couldn't remember anything. So yeah, like, and again, who am I to judge? Not a soul, okay? Not a soul. But this is another add to the defense side to say that the physician who documented on both Karen Reed and Officer John O'Keefe had some serious holes in his documentation, to say the least. And Kelly Steffi says, depends on what you mean by observed. I blacked out. I know, babe. Did you observe it on him? He doesn't know, he doesn't recall anything. And then when he goes back and he looks at his documentation, it's not there either. But then he remembers that a paramedic had this conversation with him that is nowhere to be found. Bitch. Justin, come on. Like, what are we doing? And Rebecca, thank you so much again, Lovey, says, if I have an inkling, we will need blood results. Medical staff will seal an initial for chain of custody in the event a warrant is approved later. Without seal and initial, it could be tampered with and no good. Rebecca Jones. Okay, I want to sing it. I'm sorry. Mrs. Jones and me. Okay, sorry. Like, you're absolutely right. You're 110% correct. We need chains of custody. We need to know that the process was done appropriately. We don't even know who the frig drew the blood. But here's the thing, babes, that the blood sample never went to Mass State Police. It was just from the hospital. The hospital did the tox level, and that tox level was 93 milligrams per deciliter. Then they did from 93 milligrams per deciliter, it went to, they converted it and said that it was between 0.8, like it was like around 0.08 for a BAC. And then what did they do from there? They did a hypothetical, like a Pythagorean theorem. They extrapolated that bitch. They took that and rewinded it back. And they were like, okay, it could be that Karen Reed's blood, her BAC at the time of the alleged incident was between 0.13 and 0.28 or right around there. How the fuck? How are we figuring that out? So we never even saw the specimen. And this was all pushed through, babes. This was all objected. This was every single thing. The defense said, please take another look at this, Judge Cannoni. This doesn't make sense to us. Like, you know, do you really, like, you know, we are filing motions to suppress this information that basically is the magic school bus of a fucking blood draw. You know? And Judge Cannoni was like, nope, we'll let it in. Yeah, it makes sense to us. Whew. Karen Barrows, thank you so much for becoming a new member, lovey. All right, babes. That's it. I just wanted to see your faces. I wanted to go over this testimony of Justin Rice. It is not awesome, okay? It is not good at all. And, you know, for us to just keep our eyes on what we know. Keep our eyes on what matters. And that is justice for Officer John O'Keefe. And that is free Karen Reed, because she didn't cause the injury to Officer John O'Keefe that resulted in the loss of his life. Okay? All right. I love your face. I'll talk to you soon. Bye, guys. Have a great night.